As a human, we all breathe, eat, sleep, drink, and we walk. We walk, we jump, we run. And always, while walking, while jumping, and while running, the most important part who is taking the biggest role in our movements is nothing but knee. So we have someone who is very specialized in knee surgery or the treatment of knee, Dr. Knee, with us. So you must be wondering why so much of build up. We have seen we have seen lots of orthopedic doctors. We have seen lots of surgeons. But this one and this gentleman and this doctor, Dr. Azam Badar Khan, is very, very special because of not only being a surgeon, but also as a true human who is giving a lots and lots of things to the humanity. Let's welcome Dr. Azam Badar Khan to the show. Dr. Nee, in front of us. Hi.
Thank you for having me.
Sir, instead of me talking to the people about you, let's hear from the horse's mouth.
Yes, first of all, thank you for having me here. It's my pleasure to be on your podcast. I am Dr. Azam Badar Khan. As you said, I'm also known as Dr. Knee. I am a knee surgeon and I've been doing knee replacement for osteoarthritis. But at the same time, I've been traveling to different parts of the world, which is Africa and India also, where we are having knee camps, doing awareness about knee health, and looking forward that inshallah one day we will have a World Knee Day, because we already have World Arthritis Day, but the way knee problem is becoming epidemic, every second person is having, and there are a lot of small issues in day-to-day life which are causing the knee problems, even in the younger people. So therefore what I'm trying to say that osteoarthritis of the knee, see, one thing is there is wear and tear, which is inevitable with the age.
When you get aged.
So it is inevitable. The problem what is happening is the inevitability which was supposed to be having after 55 or 60 years, nowadays it has started happening at earlier ages, 40. And there are a lot of small things which I would...
We'll come into those things which really causing the problems and how to protect your knees from everything. See, like everyone will be always wanting to know or curious to know, how did you come into this knee, and what was the journey and how was the journey actually?
From my childhood, I have been very fascinated with, as you said, that social work. I have been very passionate about giving back to the society. So being a doctor and becoming an orthopedic surgeon gave me an opportunity to become a knee surgeon, where I can do a lot about knee care and get the people moving, eliminate their knee pain and get them back into action.
When you look at the commercial side of it, normally, okay, of course, it's a divine job. The doctor's hands are always divine, and they always being a very helpful hand and lending hand to someone who is in trouble. So normally when it comes to your picture, like you will be thinking more wider of being an orthopedic than knee. So why really coming into that very specific niche area?
Because yes, that's a very good question, and then that has been asked to me quite a number of times, that why I chose to be a knee surgeon. The truth is, my father was an orthopedic surgeon. And he was a general orthopedic surgeon, and his passion was always about knee. So there is something that has come from him also as an orthopedic surgeon. But knee, as I said, is it gives me pleasure to take care about, talk about knee.
It's a truly dedication, dedicated service to the the whole humanity, being very specific, irrespective of your commercial aspects.
Yes, as you rightly said, it's not only the commercial. Basically, see, we all have to live in this world, and we have to have our bread and butter to survive in this world. But truthfully, I am basically, my passion is about knee replacement. But it's not that I'm talking about that this knee replacement, robotic, and all these new technologies which are there in the knee replacement, it is basically I'm trying to talk about how can we prevent the surgery
All right.
knee
Understand.
replacement, which I believe is not being
Knee is a
spoken
very
about.
integral part of your,
Yes,
your body.
and that is something which is not being spoken about by the
Okay.
doctors, or there is no awareness as such. There is no word or vocal.
For a fun fact, you normally say like, you will not recognize a person by seeing their face. Rather, you will be looking at their knee and they say, this is Mr. Munir.
Yeah.
That is the expertise you have got into that particular field.
Yes.
See, now people will be always, thinking about like, where are you practicing in the UAE hospitals or in India or in other countries? How is your practicing schedules?
Yes, I am based in Dubai, and so I'm associated with a few of the hospitals here, starting with Prime Healthcare.
Okay.
I'm there in the Medcare, as well as Aster
Oh,
and
okay.
IMF. So
All the big
couple
guys.
of so there's a couple of hospital, But apart from UAE, I'm also quite frequent with Africa, a few countries in Africa. In fact, I'm the first surgeon who did the first knee replacement of Somalia.
Wow.
That was 7 years back. It was Hargeisa.
Hargeisa.
So, and then apart from that, in India, I also travel, especially to Kargil, the Himalayan region, Kargil and Ladakh, where we do free knee camps. So, along with the knee health camps, I am trying to promote the awareness of the knee care, and trying to get people give a pain-free knee if they can.
Okay, all right, okay.
That's what
Now,
I-
see, now when you are coming to the UAE and India, so for a businessman, it's quite natural to shift from here to there, switch on, because it's not a something which is very very troublesome, or something task. But for you, how do you manage between India and UAE? Having this thing.
Yes, that is requires a lot of strategical move, planning, and dedication.
Yeah,
It's definitely
obviously,
the
yeah.
bottom line of it. If you have those, then definitely you can strategize your moves. But yes, is when you are in a mission,
Nothing
then
stops you.
Then nothing stops you. It's every day is a challenge, and every day you are looking forward to achieve something. So then everything boils down.
It's quite normal. You can
It's
balance.
quite normal.
All right.
Definitely.
Okay. And what are the new advancement, coming up in this, knee surgery area and in the knee scenarios?
In the era of AI, there is a lot of technological advancement which is happening, and the same thing is happening in knee also. So the recent and the most advanced thing is robotic, and AI is definitely going to have a lot of impact on our fields. But the point is that apart from the technology, there is a lot of that a human touch is required, because these
Obviously.
technology can help us, that it can
assist you, right?
assist you, but we need a human touch as far as decision making is concerned, or those basic things, decision and all those. So to get to the bottom of it, definitely technology is there, and that is going to play an important role. But yes.
There are so many layers in the knee. Like for example, now so many different materials used to replace your knees.
I have those are basically what I got your point. Like there is going to be a time when we already have a patient specific knee where we manufacture the implant based on the shape and size of a person's knee. So we do the calibration, we take the MRI, send it to the company. They will make a casting of it exactly the same size. So then half the work is done. We don't have to apply our mind. We have to just open it up and put the jig. It'll all calculations according to
That's going to come in the near future, right?
Yes, it's already there, but then I'm pretty
It will
sure
become more common now.
yeah, it'll be the way of life in future.
And there are so many myths in the knee surgery area. So about the knee and about the knee, diseases. I like how it is getting disabled, how it's getting, what do you call, some problem. There are so many myths. Because of this, you are getting this.
Yeah. See, when the issue is, as we were talking about, that it is inevitable with age to have a wear and tear on our body. The way we are aging, we cannot reverse our age. The same way, whatever the wear and tear which is happening in our knee, it cannot be reversed back. So, but at the same time, there are a lot of things that I want to project, and I've been already doing it.
Okay.
One very important thing is vitamin D deficiency.
Vitamin D.
We all know that uh, that vitamin D, 90% of the population, it's a data in UAE that 90% of the population suffers from vitamin D deficiency. People know that, okay, vitamin
And
D, why it is so important.
And medication is the only solution, or it's
No,
natural?
no, it's a naturally, we know that we have to expose our skin in the sunlight. Like in our previous years, the born child,
Yeah, I will
they would show them in the sun and give a massage, so that the whole idea was that to make their body and bones stronger.
It's true.
Definitely. Nowadays, those strengths are gone. With
No,
the
we
same
don't even
concept.
expose to sun.
Exactly. Here, the irony is we have so much of sun outside,
But
we will
never see. Many
stand
people
outside.
even they don't know. Like they have never seen.
Yes, we are all the time enclosed, so our skin is not getting exposed. So vitamin D is not coming in play, and it is very important for a calcium to reach the bone to have vitamin D. And if you're deficient in vitamin D, that is one of the main reasons that your bone gets weak, which also affects your joint. Then there are other important things that, as I see in your office, they are sitting continuously for 8 hours to 10 hours. Maybe once or twice they will get up, but when you're sitting constantly with your bent knee for hours together, over the period of time, in few years, they start having an impact on your cartilage. They have a compression.
And even the certain postures are.
Yes. So that is why it is very important that after half an hour or 1 hour, they should let their muscle move, so that the stress which is building up on the muscle should not go into the joint and affect the cartilage which is there in the joint, which starts the early arthritis. So what used to happen is, in earlier days, we would not hear about arthritis before the age of 60.
Yeah, obviously, we never thought of having someone of 40s, having a knee problem and knee injury, unless they are sports persons like
Sports. Yeah.
footballers and cricketers even have these problems.
And the problem what I face in my clinic is, we see a 40-year-old person coming, we do his x-rays, we see that there is starting early signs of arthritis. But since the myth is that arthritis is only for the old people, so we have to be very cautious when we are telling a person that your knee has started into arthritis.
See, long walkings, it causes the wear and tear, or sitting longer period of time. What do you think, like, for example, of as a business person, like normal person who works for 8 to 10 hours in a day and normal routines, and in the car, then at home, then office, how they should, really program their day in order to have a healthy.
Sitting in the office or wherever we are going, either in the car we are sitting, in the office we are sitting, but long time of sitting definitely causes that. We have to be, in previous years, why these people didn't used to have wear and tear on the joint, because they were never stagnant at one point. I would not like to call it a sedentary lifestyle, because today is the era of going to the gym and very conscious about your health. But then when we go to the gym, we 8-10 hours, whatever the negative effect has happened on your joints, it will have a pronounced effect if your vitamin D is low, your muscle, but then you are going to the gym. And with today's era, people in the gym, they are overtraining themselves.
Yeah.
So that is also not
over enthusiastic people always causes their knee
into starting on the wear and tear. Either they will land up with an injury to their ligaments, which is meniscus.
Everything more is a problem.
Yes. So nowadays it's a saying that everything should be in moderation.
Yeah, obviously.
Even diet and
everything, even your screen time, your usage of your social media, and even AI usage should be moderate.
Everything should be moderate.
All right. Now the question to doctor would be, like, for example, how important the rehabilitation and the physiotherapy, for a knee.
That's a very good question, and knee replacement and physiotherapy go hand in hand. Why? Because knee replacement is something that we are giving to our patient or a person a new knee. But for that new knee, it's an artificial new knee, to behave or function properly, it is physiotherapy which teaches you. So there is a very subtle
It's very important. It's
yeah,
as equal as you are having the surgery.
surgery.
Then
So
post-surgery
yes.
is
So just doing the knee replacement
Not
is not going to give you efficient knee replacement. To have the knee
that
replacement
means you are
successful-
making the new knee adjusted to your body, adjusted to your movement sector.
yeah. So the function of the knee is to bend and extend, and a little bit of movement, so rotational movement. So when we are giving a after a knee replacement, when we are giving a new knee, it has to be physiotherapy, because to get it in the movement, complete movement, and also for the muscle to strengthen, to manage that new knee which is there.
All right. And rehabilitation as such.
Yes,
You should have.
yeah.
If you want to if you need to take rest, you need to take rest. Especially for sports people, like
Yes,
okay, international people, okay, always they have their own regime, to do that. But normally, in our age, like normal people, sports people, they cannot even sit for 1 week or 2 weeks rehabilitation after any.
Any surgery, yeah.
So it causes problem again.
Right.
All right. See, doctor, for the young adults and young people, what are the advices you can give them to protect their knee? Majority of those people have always knee problems. They have not arthritis or wear and tear kind of a thing, but there are so many other problems they're facing. So sometimes for the fast food, sometimes the obesity, kind of a thing. Sometimes overweight, this causes the problem. So what are the advices you want to give to these young people?
The first and the foremost important thing, which I've already mentioned, is every young people, first of all, you should not have a mindset, or you should not think that arthritis is a disease for the age. It is nowadays. Trust me, I can give you hundreds of examples that a lot of people, young people are starting arthritis at the age of 30, 35. And as I've already mentioned, vitamin D is one of the major problems. The second thing is, whenever you're going for any sports or going to the gym, please take care, give some time for stretching and strengthening of your muscles. That is the main crux of
that as equal as
saving the joint. Yeah, because joint is, if you don't do your stretching and strengthening, especially I'm talking about the quadriceps, the thigh muscles, what we say, it has to be stretched and strengthened. A lot of people get two things I would like to mention at this point, that this 10,000 step a day, which has become a norm. I'm saying everybody is talking about
minimum.
But we are not. 10,000 step is very good for your internal health. When we are talking as an orthopedician, when I'm talking about the musculoskeletal system, which is an external health, so which is a mechanical health. So for mechanical health, it is pertinent that you need to do 5-10 minutes of stretching and isometric exercises, what we call core muscle strengthening exercises. Just walking for 10,000 steps is good, but not good enough for your external health, for your joints.
Brilliant. So what inspired you, doctor, as I know your father was a doctor and, orthopedic doctor. Other than that, it's not necessary majority of the people should go in the same line of their parents. I was not, and my son is not. So in that case, what inspired you to become a doctor, then to very focused?
Yeah, there is two parts to it. What inspired me to become a doctor? My parents. It was my father. My grandfather was also a doctor.
Okay.
My elder sister is a doctor. So I would say that I would not shy away from saying that I wanted to be a fighter pilot. That passion has still not gone away. But yes, I came to this field because of my parents, especially my mother. But over the period of time, as I said in the beginning, that I have a passion of giving back to the society and serve the society. So that clicked very well with my coming in this profession, because as you know, that this is one of the most noble profession in the world, and it has been there ever since the human being came into inception. So I was that way I was lucky that I got this chance, and therefore so with time, I found that knee is the most important joint of your body, which takes your while walking, climbing, everywhere.
And then you
The
hook
pressure
up.
is coming to
Then
the
you hook up it.
yes, and then when I started doing knee camps, as I said that to give back to this, doing free knee camps and then helping the poor. Then I realized at that point of time, I realized that this serving and doing free knee camps and knee replacement is something which is a never-ending story.
Yeah, yeah, obviously.
But then I need to go beyond that and tell people that how can you save your joint from getting to that point where you have to do a knee replacement?
Surgery, yeah.
And especially with this era where the osteoarthritis, which was supposed to start from 60, it is nowadays, let's say 20 years before it is starting. So it becomes very, very
So
important.
you give
that
awareness to the people
People.
to protect your knees from the surgery.
surgery. Especially, I want to take this awareness campaign, knee health awareness, what I'm talking globally, to focus on the young people. With this occupational thing, sitting and those minor vitamin D, sitting for long hours, going to the gym, not stretching too much, just trying to build up their muscle mass they want. So those things for the young people, it is very important to get them that no, now the time has come where early signs of arthritis is starting in young people itself. Don't think that it is only for the old people. And if any doctor is telling you that your knee is showing signs of arthritis, you have to take it seriously. So take your health, especially the knee health, very, very important.
That is advice to the young people. See, now everyone will be really excited to know, other than knee and surgery and all, what other hobbies you are engaging you in your life.
There are a lot of things that I'm an outdoor person. I love being in mountains.
Okay.
I like trekking, biking to the mountains.
You always
So,
look heights.
Yes,
You want to fly.
I've been.
You want to fly, and
I
you
have
want
done skydiving also. I have been to Mount Everest base camp twice. Been to Kilimanjaro. I've done Antarctica also. So
that's to keep
my
yourself
passion
fit.
is.
See, doctor, now this surgery is, especially the medical field, is a stressing field. Obviously, we all know doctors are always stressed because they don't look about themselves. They look about even they're sleeping. They look about the patient what they have treated today. So in such situations, like you will be very busy. India, Africa, UAE, and other countries, a lot of operations, a lot of knee surgeries. How do you manage this stress level in between, your lives?
As you rightly said, that nowadays you will hear a lot of doctors because of their stress.
Yeah,
they
yeah,
are having
yeah,
those.
yeah.
Recently, we had a doctor from Kerala itself,
Yes,
Dr. Anwar, who had a heart attack. He was not even 50. He was
Yeah,
like
it's very
47,
young. Yeah.
very 47. Yeah, I knew him very well. And there are so many examples like that. You have to, it is after all, our profession is where we can't take it very lightly because we are dealing with a human life, human care.
It depends on you. It's not like other businesses.
Not like
I
other
can
businesses, yeah.
close the business for a day. If
Yes,
it doesn't
yes.
affect other come
What will affect? It will financial problems
obligations.
will have that will happen. But in when we are operating, we can't take any chances, and we have to be very.
And you have come across many times like this, right?
Yes, it
You have to
is.
sacrifice many things for the
Definitely, and then especially the family life is definitely it goes into stakes. But as I said, that you have to have a mindset that how to balance your.
So you are, how do you, this is the mantra I want to hear from you. Like, how do you manage that? Like, is there any specific things you do, or is this naturally you leave it as, you're a born doctor?
I see. I believe in yoga.
Okay.
So breathing exercises
Techniques, yeah.
is technique is very, very important for me, and it helps me in not only the medical stress, even the normal day-to-day life stress.
Keeping yourself calm.
It definitely brings your mind at calm, and in yoga there are pranayams and all that. Mainly the pranayam, which is I'm following the breathing exercise. What we say that inhaling and exhaling, and few other techniques. So that is one of the thing which keeps me going. And when you're, for me, medicine is, and especially knee replacement, is a passion. So when you're following your passion, and then now I have a vision to have a World Knee Health Day. Last year I was in Geneva at WHO for World Health Assembly. I was called to hold a seminar on bone health and knee health. So I have been pitching there that it's time that we should have World Knee Day, because the kind of, you will be surprised to know that knee replacement in the next 20 years, it is going to become 4 times more what we are having today.
Okay.
That's the American data. So, and we all doctors are focused on knee replacement because everybody, right, left,
Yeah.
and center, people are getting knee replacements done.
All right. And in the UAE, like for example, what do you look at next 5 to 10 years in the orthopedic and especially in the
As we said, the technology is definitely it is there already, and it is going to play a very major role. Robotic is already there. AI is, we are all watching.
That's the next
patiently.
thing I was about to ask you.
Yes.
How AI and robotics are going to.
Yes, at present, robotic is not completely robotic. It is a robotic assisted
Hybrid.
assisted knee replacement, where our role is there with the robot. It's guiding us, but in future it will be more customized to the patient's need. So with the AI technology, I'm pretty sure that knee replacement is going to be more advanced, more precise. There are a few technical things which I would not like to go into that.
So AI and robotic going to play a significant role in the knee surgeries area.
Yes, they play they have already playing, robotic is already there. So, but then when we are talking about AI, it'll be having a more patient specific demand, and requirement will be fulfilled. And people will have very less rehabilitation time, recovery
Yes,
time
yeah,
will
yeah,
be very
true,
less.
true.
They will be back to their normal life. Now it takes a few weeks
No,
to
like
get back.
even now, like when we our ages, when we had a surgery, we had to sew it, like the those things.
The
And now it
implants
is
and
just a
sutures,
plaster. You put it and
put it and it comes out.
yeah. So there
So
are so many
definitely
things.
those things are coming in the healthcare. It's already there. Recently we heard that in China they've had a AI hospital
You can access the treatment from anywhere.
everywhere. Yeah.
And how do you think, like, how can, what is your vision in making these things accessible to common man, to everyone? Like, for example, many times, like, we feel that the treatment is only for luxury sometimes because it's very expensive sometimes. But in your vision, I've seen you're going to the mountains, to the common man, and creating the awareness, make them feel you don't need to spend so much money, rather you take care of yourself, getting into that dangerous situation.
Yeah.
That's something really awesome. And what is your vision making it to?
That's a question which is very close to my heart, and I run a civil society NGO which is called Let's Walk Again with Dr. Nee. So Let's Walk Again with Dr. Nee is all about getting people, getting them their need to be moving around, giving them care. So when I go globally, hold this knee camps, and through these knee camps, we are promoting that how they can take care of their knee, these small basic things. And the main focus is to give this opportunity to the people who are less privileged to afford these kind of surgeries. So I have people who are supporting me financially when we are doing these knee camps.
Okay, if someone like that, he can get in touch with you always.
Definitely, definitely.
All right. See, the vision is very clear. The action and the mission is very well curated, and Dr. Nizia, and all these professional things, and your stuff which is helping the people, community, and to make them walk again. That's what Let's Walk.
Let's walk again.
So you make everyone walk. Walking is something which is close to your
And that is what gives the most pleasure when you see your patient walking pain-free after whatever treatment you are giving, whether it is less invasive or more invasive, like even recognizing the problem in the early stage is the most important thing. As I was talking in the early stages, because most of the time what happens is in osteoarthritis, when it is in early stage, people are not bothered. It is when it becomes moderate and advanced, then the only option left is knee replacement.
It was a very long conversation. We got, tons of information from Dr. Nee. And towards the end, I have, a few rapid,
Yes,
questions.
sure.
I'll ask you 5 questions and you just tell me the answer in one word. One word that describes you.
I am a passionate person, so I am following my mission of World Knee Day.
There is any word that, let's walk again, something like one word which.
That's a slogan of mine. Take care of your knee the way you take care of your heart. Heart gives you life, knee gives you quality of life.
All right. So then the favorite place to travel?
Mountains.
Obviously.
It keeps you grounded, gives you
And it shows.
your height. So once you go into that dangerous zone, it makes you realize that how to be grounded in life.
Coffee or tea? One gadget we cannot live without.
Sorry?
One gadget. Mobile?
Sorry, but it's mobile.
Mobile is what?
Mobile is the whole world nowadays.
Okay.
It's starting from your, it does the job of your office, your hospital, even
That
all my
itself
patients.
becomes.
Yeah, like I would try to tell that all 50% of my mobile contacts are of the patients. Like I give them my WhatsApp number.
That's an
so that-
assistant. That is your companion.
Companion.
That is your, whatever, the personal assistant.
Yes.
It carries.
So we can't live without mobile. I think that goes for everybody.
And the last question: one quote you live with. One quotation, like what you love most.
I love being in this world. It's a beautiful world, and serving the society is
Brilliant.
what I am there. And through my profession, I'm privileged that I have this profession, and with this, God has given me this, serve the
serving the
community
humanity.
and given me this idea into me, inculcated into me that with the knee. So I'm really blessed and thankful to.
And your service to the humanity is the most brilliant.
And if I can, I will also not shy away from saying that I'm the first person in the world who's talking about knee health awareness.
The only Dr. Nee, the one person, one and only Dr. Nee. See, that is something very special. And dear friends, now we are concluding the show. It was so awesome and wonderful being